Welcome to the Neurology Live Mind Moments podcast. Tune in to hear leaders in neurology sound off on topics that impact your clinical practice. I'm your host, Marco Meglio, editor with Neurology Live. In this special episode, we sat down with ALS experts James Berry, Chief of the Division of ALS and Motor Neuron Diseases at Mass General, and Jinsy Andrews, Director of the ALS Center at NYU Langone, to give a post-conference perspective on the 2025 NEALS Annual Meeting. In this interview, the duo spoke on the major themes and ideas from the meeting, as well as the conversations around the latest and most advanced clinical trials in ALS. In addition, the two talked about the new innovative approaches being introduced, the potential for combination treatment in ALS, and the expansion in genetics. Lastly, Berry and Andrews gave a preview of the 2026 meeting and some of the concepts that are going to be introduced next year. Let's dive in.
I think it was really a great meeting. We put a lot of work into kind of really taking feedback from previous meetings and making some changes to the format that I think were pretty well received. So we had more lightning science talks and sort of embedded some of the scientific talks and translational talks into the middle of the meeting. So that was really exciting to see what's coming. We also have a number of really exciting trials that are getting off the ground now that are really kind of the science behind them is really fabulous. And so we got to hear about a few of those, the ones that are NEALS affiliated trials. So there's a process for trials to become affiliated with NEALS called the NEALS affiliated trials. And one of the perks is that we talk about them at the annual meeting and get an overview on what their progress is and what the science is. And the science going into these trials is so incredible. And the other thing about NEALS annual meeting is that it is a place, I think, every year where researchers and sponsors and study teams kind of make new collaborations, catch up on their collaborations that are going on. And it's really sort of an incubator for ideas. And that definitely was happening this year. And that was super exciting. And it was our 30th anniversary. And so we got to kind of hear a little bit about the history of how we got to where we are with NEALS and kind of the smaller beginnings and then compare that to the incredible group of people who came together for this meeting, almost 600 people in person. And I think about at least 300 that were joining remotely as well.
I think I will just segue from what James just said. It was 30 years and we talked about our history. We did get to really evaluate what we've done in the field for 30 years for amyotrophic lateral sclerosis and really think about our beginnings started as a few centers in the Northeast. So we were the Northeast ALS Consortium. We announced our new name, the Network of Excellence for ALS, and we do have over 150 sites across US, Canada, and internationally. And I think it's really amazing to see the progression of how we started as a group of small researchers. And this year, we did feature, as James said, a lot of the lightning science talks, thinking about new targets, new approaches. We were really excited to share some of our NEALS affiliated clinical trials. So we partner with industry and investigators, and some of which is some new exciting science, like taking gene therapies, which everyone just decides or thinks about as a small subset of people with a genetic mutation specific, so that may just only benefit those individuals. But really, we were able to highlight some early clinical trials focusing on specific targets that might be relevant for sporadic ALS, which is a broader group of people living with ALS. And those technologies include using adenoviral vectors to target specific therapies, and also using antisense oligonucleotide to target specific gene targets that might be relevant for more broader populations of ALS. So it becomes more important to identify people earlier in their symptom onset, earlier after symptom onset, so that we get them to the clinics and they get opportunities to participate in clinical trials.
I mean, we've definitely seen, obviously, an increase of these kind of trials, early stage trials, especially some of these new novel mechanisms. Gene therapy has obviously been a huge buzzword across not just ALS, but a lot of other different specialties of neurology. Dr. Berry and Dr. Andrews, you guys kind of alluded to the fact that there were a lot of NEALS related or NEALS sponsored trials that were presented at this meeting. So talk a little bit about these trials, talk about some of these emerging trials that the clinical community should maybe keep their eyes on from a drug development standpoint.
I think I'll give it a go, and then maybe Dr. Barry can jump in. But we really highlighted a couple of key NEALS affiliated clinical trials. One of which was the Healy platform trial, which has been a real engine to really test drugs in the pipeline efficiently using pooled placebos. And there's been a transformation in the clinical trial design because we've learned so much from the first few regimens. Actually, it's been running for 5 years. We've already tested about 7 drugs and gotten answers. 2 of them are graduating to phase 3 studies. And we have 3 more that were announced to start. So it's a very quick kind of infrastructure to launch evaluation for investigational therapies in ALS and move through that pipeline, right? Because so in ALS, we're working with very little time. And this is led by Dr. Sokovich and Dr. Paganoni over at MGH, and also from MGH is the MyMatch trial, which is an early phase trial that actually helps to evaluate people based on biomarkers and trying to be using precision-based matching for experimental therapy. And really, I think that this might be the wave of the future for even individuals with sporadic ALS, identifying what's the predominant mechanism in their disease. Is it oxidative stress? Is it neuroinflammation? Is it mitochondrial dysfunction? And targeting experimental therapy to that predominant mechanism. We also were able to highlight another gene therapy. So we already have tofersen that's out there for SOD1 associated ALS. That just recently received approval in 2024. And so that pressures our whole medical community to find these people with SOD1 and get them treated because it does make a difference. One of our researchers, Dr. Tim Miller, reported 2-year, 3-year post-treatment benefits of tofersen in SOD1 ALS. And this is really miraculous for us, kind of proving the point that maybe ALS could be a chronic treatable disease. It could be a livable disease. And then on the heels of that are groups like Unicure trying to develop a one-time, one-dose treatment using adenoviral vector therapy. So they presented data on their early phase 1 therapy in SOD1 ALS. And we also had a couple of other trials, including Amylyx's calpain, antisense oligonucleotide targeting calpain, present their updates. Those were the platform presentations. But we also have a slew of other, like I mentioned, NEALS-affiliated trials that are really using novel targets, novel therapies, like Trace Neurosciences targeting UNC13A using antisense oligonucleotide. We have Leal Therapeutics targeting SPTLC1 using antisense oligonucleotide, and we also have Insmed targeting using adenoviral vectors targeting a gene target for all sporadic ALS. So this is a new wave of clinical trials, an innovative way to kind of approach experimental therapies.
Yeah, no, that's right. And I mean, so amazing science. I have to say the science that's going into these affiliated trials now is just sort of leaps and bounds ahead of where we were years ago. And I think a lot of that comes down to, our community trying to build an understanding of the disease. So that's the bridge between bench and translational researchers and clinical researchers. And it's really a place where a lot of observational studies come into play. So I would just highlight that another NEALS affiliated study is the All ALS study. This is funded by ACT for ALS. It's already enrolled now 1,000 people. At the NEALS meeting, we were just shy of 1,000 people. We've now surpassed the 1,000 mark. The goal is to get to 2,000 participants. And we're collecting blood and clinical information. That's giving us these insights that is really allowing the science to move forward like this. So we're blood and spinal fluid and digital endpoints and clinical endpoints and speech endpoints. So really comprehensive. And I think that's just incredibly exciting for the field. We also have some expanded access programs that are funded by the ACT for ALS. So there are, I think, 4 of those that are NEALS affiliated. There's Pridofidine, Rapid Therapeutics, Clean, which is the CNM-Au8 drug, and Ibudilast. Each of these is providing access to people who don't qualify for clinical trials, because we know there are a lot of people living with the disease who would like to be a part of a clinical trial, who would like to contribute to science, and don't qualify for one reason or another. And so, these programs allow us to gather safety information in a more generalized population and provide access to people who have the disease, and at the same time collect biofluids, clinical information, and really forward that process of understanding the disease. So really, I think that's something that's been newer to our field. It's been around for a long time in other fields like oncology, but that focus is really exciting as well.
Yeah, I think I just will highlight just on the tail end of that is that, the federal funding through Act for ALS, we received, the bill was signed into law in 2021 in December and really has been transformational for the field of ALS, has really jump-started us to do things like developing this scalable, large, centralized repository called All ALS, studying not only symptomatic ALS, but for the first time in a multi-center fashion, looking at people who are at risk for ALS for the first time ever. And I think it's really important to point out that, a lot of people focus on the expanded access portion of it. But these traditionally expanded access has been kind of associated with just treatment, but we are collecting information. These are more like research projects. So it's not just providing access, but studying biomarkers, exploring novel exploratory outcomes, and pooling all of the information that's collected. So all of them are collected the same way in all of those NIH-funded expanded access programs. They're all kind of collected and put under the same hub called BioSend. It's a central repository controlled by the NIH. They're all coded the same way with a unique identifier, and they're all open access to scientists, not only doing ALS research, but all scientists across all disciplines. And so it is a scalable, supportable a kind of repository with clinical information and samples that could probably unlock why ALS occurs in people living with ALS. So we're providing access to experimental therapies now, but also trying to learn about the basic biology. And that's what this federal funding has done for our field. And, we are super grateful for it and hoping for continued funding in the future.
Really, really amazing and transformational stuff. And obviously, we've seen a lot of change with ALS clinical trials over the last couple of years and kind of making adjustments. And this is kind of speaking exactly to those sort of things. I'm also curious, we've talked a lot about the trials themselves. We've talked a little bit about some of these new novel mechanisms, but I'm also curious from your guys' perspective, how much conversation has been talked about potential combination approaches or even trying to find synergistic targets? Because we often hear that, and that's a conversation that gets talked about more in other things like neurodegeneration, like Alzheimer's disease now that we do have some approved therapies and, even some other different types of neurology specialties, depending on who you talk to. So I'm curious, has the conversation around combination approaches been discussed? And if that has been discussed, what could that potentially look like for patients with ALS?
Yeah, so it certainly is a topic of conversation. I think it's important for diseases, particularly where we think that there are a number of different sort of pathologies going on at the same time. So, if we think about something like multiple sclerosis, where really the primary focus has been on inflammation, and and the drugs that have targeted inflammation have been remarkably effective thus far. Combination therapy hadn't been as much of a focus. It could change for MS as they sort of get really effective at treating the inflammation. In ALS, we know that there are multiple problems that are going on at the same time, like other neurodegenerative diseases. Many of them seem to come back to problems with sort of accumulating proteins like TDP-43 in the cell, but that sets off a cascades of inflammation and cascades of sort of ER stress and excitotoxicity and sort of a number of RNA processing problems, a number of things that are going on in the cell at the same time. And it may be that we need to target many of those at the same time. And so I think there is a real excitement about combination therapy. It can be more complicated to approach, but there are trials that have done this and are doing this. So there is a trial of a combination therapy that's also coming into a phase 3 of a drug called Prime C. And so that's sort of, I think, the tip of the iceberg probably for combination therapies. Probably, though, there will be more and more combination therapies coming because of this phenomenon of multiple pathways being affected.
I think that until we know exactly what the root cause is, especially for sporadic ALS, I think a lot of the development programs will focus on, already we are testing experimental therapies for the most part on top of standard of care. So whatever's already approved in that region, people will be on, and then it's added, the experimental therapies are usually added on top of that and may not overlap the mechanism that the approved therapies might approach, right? So Riluzole, for example, is the first drug that came on, and that targets glutamate excitotoxicity. And edaravone is approved in some regions that's targeting oxidative stress. And so and I think a majority of the pipeline right now is targeting various aspects of neuroinflammation. And then there's T cells and stem cells also in play in addition to the gene therapies that I talked about earlier.
We're going to take a quick break from our conversation with Dr. Berry and Dr. Andrews to keep you up to date on the latest developments in neurology. Welcome to the Neurology News Minute. Here's what you may have missed since our last episode. First, on November 3rd, the FDA approved UCB's doxycycline and doxorubicin, a fixed-dose combination treatment, as the first therapy for patients with thymidine kinase 2 deficiency, or TK2D. Marketed as Kygevvi, this combination treatment targets the root cause of TK2D, giving patients and families newfound hope for treating the disease. Next up, on the same day, Axsome Therapeutics announced it submitted a supplemental new drug application for AXS-05, an investigational combination treatment, as a new therapy for patients with Alzheimer's disease agitation. The sNDA was based on several Phase 3 studies, including ACCORD-2 and ADVANCE-2, two double-blind placebo-controlled trials. And finally, on November 11th, newly announced findings showed that fenebrutinib, an investigational BTK inhibitor, met primary endpoints in its Phase 3 trials of primary progressive multiple sclerosis and relapsing MS. The studies included the FENhance-2 trial testing fenebrutinib against teriflunomide and the FENtrepid trial pinning fenebrutinib against ocrelizumab, the only approved treatment for progressive MS. For more information about these stories, head to neurologylive.com, or you can check out the corresponding link in the show notes. And now, back to our conversation with Dr. Berry and Dr. Andrews.
A lot of innovative approaches, to say the least. And we obviously, like I mentioned, combination approaches have been talked about more and more in just neurology, obviously kind of transferring and taking a little bit from the oncology fields, which have obviously kind of championed a lot of that kind of stuff, 15, 20 years ago. So starting to see those things eke a little bit more into neurology, year by year. So I'm also curious from your guys' perspective, we talked a lot about the fact that there are not just the familial side of things, but the genetic side of ALS. And, there are some of these genetic-based cases that, don't have a lot of patients per se, and their groups are kind of on the smaller side. So how do we kind of continue to advance clinical trials for future therapies for these smaller populations of groups, these subtypes of ALS, and just talk about how we can get more patients into clinic despite some of the low numbers that we do see.
I'll start here because I really feel strongly about this. I have been kind of going to meetings explaining the importance of genetic testing and really trying to make sure that people understand that there are clinical trials for genetic forms of ALS. And I think having those clinical trials helps to identify individuals and pull them into clinics. So just by offering the clinical trial, we're increasing the numbers of people that actually present to the clinic. Now, I will say that traditionally, we've gone a long time without a drug, right? So Riluzole was approved in '95, and we went a long time without any success in clinical trials. And there was a slight nihilistic approach, what else can we do for these people? Why should we send them to an ALS clinic? There's nothing we can do. And I really want to change that perspective for neurologists, for physicians, anyone who's a healthcare provider, or any person that knows somebody with ALS, because it's really surprising to me, actually, how not only individuals with ALS were willing to do genetic testing in the early days of clinical trials targeting genetic forms of ALS, but as we grew that pipeline for specific mutations in ALS, and as the technology improved, one of the highlights of our meeting was the keynote speaker, Dr. Claire Cleland from UCSF, talking about CRISPR gene editing in C9orf72 and talking about the lab-based model and how to expedite getting into human clinical trials. So she proposed this innovative way of testing the experimental therapy in brain dead individuals who would become this human kind of experiment for safety and toxicology so they can get into human clinical trials faster. So technology is there and we just need to leverage it. But as that pipeline grows, I was surprised to see the interest in family members of people affected with ALS and who carry a pathogenic gene mutation who are willing to get tested even before they got ALS. And so we do have a clinical trial right now targeting pre-symptomatic individuals with SOD1 called ATLAS, and that should read out soon. But the wave of the future will be trying to prevent ALS from happening, not only in genetic individuals, but also maybe in sporadic individuals when we learn more about what exposures increase your risk of ALS.
And yeah, that's right. And one of the panels included Gene Swidler, who started a group called End the Legacy, which is really, I think, an incredible kind of partnership, which is bringing sort of the perspective of people who are living at risk or potentially at risk of developing ALS to the conversation. And that's, I think, so incredibly important in keeping us directed toward the right sort of science and trials to do to try to prevent ALS in these genetic cases. The other thing I would highlight is that Stan Crook joined the meeting to talk about NLORM, which is a nonprofit organization that he started to really be able to target these almost N of one, singleton kind of mutations or very rare mutations in an effective way by designing antisense oligonucleotides specifically for a mutation. And I think there's a huge amount of excitement about that truly personalized medicine approach. And he gave just a really compelling talk about how we can do that.
Well, hearing all of the different types of technology and the different types of innovative ideas being brought to the table is really, really interesting. It's really awesome to see. Kind of just speaks to where ALS has changed and grown over the last 5-10 years or so. And where it's awesome that we're able to have these conversations, to say the least. Dr. Andrews and Dr. Berry, thank you both for taking your time. I have one last question for both of you guys. Obviously, this year's meeting was phenomenal in and of itself. A lot of great science presented here at this year's meeting, but how can we kind of build momentum towards next year's meeting, and what's kind of maybe potentially on the docket for next year's meeting, if you guys have even thought about building that out?
One day after the meeting, we had a text chain going about sort of what. I think it's immediate that we start thinking, okay, what went well? What could we do next year? And I think we have some great ideas for next year. There were, some of the members of NEALS had really wonderful symposia that they were able to do at the meeting on G-tubes, on respiratory care. And I think we have some ideas of expanding some of those for next year, which is really exciting. I have to say, I think one of the really exciting things about next year is that we'll see some of these seeds that are being planted now growing. And they may not be completely full grown next year, but we'll see things that are theoretical or sort of planned for trials now that are in the midst of a trial next year. Some of them may be complete. We'll see outcome measures, technologies that are being presented in posters really coming to fruition next year, things like digital health technologies. So I'm really excited to see a lot of these seeds really begin to grow for next year.
Yeah, I can't emphasize enough that a lot of the concepts were presented this year. So we talked about Act for ALS and the funded studies. Those studies were launched in 2024 really, and really operationalized and moved forward, and we're waiting for data from them. So a lot of information will be shared next year, and the impact on the infrastructure for our research in ALS, our biology, our basic science, based on that funding. So we'll have a lot of data to support how that's been transformational in our field. I mentioned some of those early phase gene-targeted therapies for sporadic ALS, so we'll learn a lot about the safety of those, or at least what their status is next year. And then trying to really be innovative in the field and continuing the platform study and the MyMatch study and really trying to make a bigger impact on the cohorts that we study. I think also I'll just leave with the real highlight of that meeting. I mean, there's a lot of science, right? There's a lot of innovation, and we love being that platform to share that. But really, ultimately, is the collaboration portion of it. ALS, we're small and we're mighty, right? But we can't do what we do. And we've done a lot And we're working our way to the cure, but we're doing it with the help of people living with ALS and their families and advocates. We're doing it with our industry partners. We're doing it with our nonprofit organizations and foundations who have been really collaborative, especially in the climate that we were in for funding for research this year. And really having all of those entities, including our government partners who have been very essential in the funding and support for those projects, like NIH, FDA, and Congress. Really, I have to put a shout out. But all of that really is what has made the field grow exponentially in the last 4 years. And so we highlight those roundtables and those people. We have an industry roundtable. We have a research ambassador roundtable, which is people living with ALS that have gone through formal training through our NEALS Clinical Research Learning Institute and advocate for research, whether it's policy, whether it's education or information sharing. And we also have now our new roundtable for organizations called our ALS Organizations Forum. So we're really excited to bring everyone together again in 2026. I think we're just going to get bigger and better.
Thanks for listening to this episode of the Neurology Live Mind Moments podcast. To support the show, be sure to rate, review, and subscribe wherever you listen to podcasts. And as always, for more neurology news and expert-driven content, visit neurologylive.com.